It was just such a great placement that it just exceeded my expectations.
I got to see every different aspect of mental health nursing in 1 week.
So I found the experience was really different to what I was used to, which made me excited to know what else was available in the diverse career of nursing.
I come from a metropolitan hospital and went out to a community regional team, and the differences are massive.
I had the opportunity to come up here and see Prince in southwest Sydney and see all their different facilities and the amount of consumers they look after and how they manage that.
So I did a placement in Lismore, the MEC unit there in emergency, which was really different to what I was used to. They were seeing clients come off the street, didn't know their backgrounds, and had to kind of build a therapeutic relationship with them from scratch, which I found really interesting but also really challenging.
I was out in community health, which I've never experienced before. We did things like home visits, we drove 2 hours away to talk with other mental health nurses and come up with plans for clients, and got to see a whole different side of mental health nursing.
I took her to subacute rehab, which is giving him better understanding of different facility.
I also got a chance to spend some time with the adolescent team, so I got to see their inpatient unit and their community team and speak to them about how they manage presentations of young people who present to emergency.
There's obvious differences. I mean, the reasons for presentation can vary. I mean, there was one thing that was made really clear to me is how the drought out there is affecting mental health. And drug and alcohol was also an interesting thing to see. Even though the rates of addiction and things like that are pretty similar to here, how it looks is different.
It was just eye-opening. I was born and raised and educated in Wagga, and I work in Wagga now.
Yeah.
So it's just this one little town that I've done everything in. So it was nice to come to Sydney and look at all these different facilities that they have, and all the multiculturalism of the nursing and the patients and the challenges that come with that.
A highlight for me was definitely seeing a patient scheduled under the Mental Health Act and seeing what that entitled with police and ambulance involvement, which was really interesting to see how people come to be in that position.
Just being able to see the vast difference in clients all over the place and get to experience the countryside like that was just awesome.
You can learn so much from the senior members of the staff and the way that they deal with patients and different techniques that they look after patients. I think I'll take that back with me.
I got to see the strengths that the Lismore adolescent team had, was able to suggest things to my own team, mainly around the use of personal electronic devices, which our unit isn't using at the moment but are now looking into.
Care planning and discharge planning are two things that I really got a new perspective on, and I've been talking with certain people at work and seeing if we can implement some new ideas in. So it really has benefited my practice and hopefully will benefit the practice of where I work.
Alan, I agree with that. She shared a lot of her experience from that where she works, bring to the staff over here. That's something I think is benefit for me too.
I think the placement was even better than I'd expected it to be. I didn't realise that I would learn so much from simply a week being away in a different environment.
Community is something I've already had an interest in before, but now that I've tried it, it's definitely something I'd consider.
Through this program, they easily go see everything what the different facilities do, especially urban to rural, rural to urban. It's make a big impact on their learning and practices.
Definitely apply. It's the best opportunity you'll probably get as a registered nurse.
Do it. Just put that application in and do it.
It's really good opportunity.